Hi, I'm Dr. Sartaj Grewal. I am a cataract and refractive surgeon practicing at Grewal Eye Institute in Chandigarh. So today I would like to talk about the ICL, which is a very good option for those who are considering spectacle independence. So basically, most of us would have heard about laser options for glasses removal. There are multiple different procedures in that you might have heard of. How laser vision correction works is basically that we are trying to change the shape of the cornea, which is the front transparent part of the eye. Effectively, if you have a minus number, that means the shape is too steep. So we want to flatten it a little bit. How we flatten it is by removing something from it in order to flatten it. So when we are considering laser surgery, we do a lot of tests to understand what is the shape of your cornea, what is the thickness of the cornea, can we safely remove the amount of tissue that we need to remove in order to correct the number. Many times when we do the test, we might actually find that laser would not be a very safe option for you. In those situations, we very like to move over to another excellent option, which is called ICL, which is basically an implantable lens. This lens is obviously placed inside the eye. It sits on top of your own natural lens. We do not disturb anything. We do not remove anything inside the eye in order to implant this lens. If at any point we can easily remove the lens and you go back to where you are, so it's a 100% reversible procedure. For patients, especially those with higher numbers, thinner corneas, laser becomes a subtractive procedure where we're removing something from the eye. This is an additive procedure. We're very simply adding something to the eye. So it's very stable, very safe, excellent visual outcomes for patients who have especially higher numbers or might not be very good candidates for laser. Uh, it has been around for nearly 3 decades, so it's not like it's a new technology. Over the decades, obviously, there has been a lot of improvement that has been done in the design of these lenses, in how we calculate the power, how we calculate the size of this lens. Because the unique thing about this lens is it's very customized for your eye. It will be customized on the basis of your power, or basis of your cylindrical number inside the eye, the axis on which that has to sit. We have to take multiple different measurements of the eye so that we can decide exactly what size lens would be suitable for your eye. But basically, we have to do a lot of tests. Takes about 2 hours, maybe almost, to do all these tests, get all the measurements we need. It's very important that we do a good dilated eye exam where we check the back part of your eye, the retina, to make sure there are no weak areas. If there are any weak areas, we just go ahead and laser them in order to strengthen them. Once we have all these measurements, we basically share them with the companies. They have their own calculators. They tell us what size, what power lens has to be implanted. Once we check all that, okay it, then lenses are ordered. Depending upon your particular eye structure, it can take a few days, a few weeks for the lens to come in. Once we have the lens, we basically plan this procedure. As far as the procedure itself is concerned, it is very comfortable. I would say that from the patient's perspective, it is not very different from undergoing a laser procedure. It takes about the same time. The implantation process is hardly 3 to 4 minutes per eye. You can do both eyes simultaneously, or you can space them out depending on surgeon comfort. Uh, we do make a very small incision, which heals quite quickly within a few days. There's no suture, there's no injection that is given around the eye. We very simply just place some drops. Those drops are anesthetic drops. They will numb your eyes so that you don't feel anything during the procedure. Again, we prefer to give some anesthesia. We have an anesthesiologist in the OR. They make sure that you're comfortable so that you're not anxious, because naturally, any procedure, there will be some amount of anxiety. Uh, so the anesthesia, both we do give an IV line so that you are a little sedated. We put drops to numb the eye. Then after that, there's just a bright light that you have to keep looking at. And I think about 3 to 4 minutes, and the procedure is done. Uh, the aftercare of the procedure also is quite comfortable. The day the procedure is done, vision would be a little blurry. The next day, vision is better, and I'll say by the third day, vision is pretty much back to normal. Then aftercare, main restriction is just no water on the face for about 3 days after surgery. After that, you can wash your face, wash your hair, be back to almost your normal routine. There will be drops that have to be used. These drops will be for about a month. They're tapered off slowly. And in the long term, you can, I would say at 2 weeks, you are absolutely back to normal. There will be a lot of patients who will ask, are there any long-term restrictions in terms of, can I not do certain adventure activities or certain physical sports? There is no such thing. You can be absolutely back to your normal life. You can be skydiving if you want. You can be in any kind of sports. These lenses are very safe. God forbid any little impact also, they are usually very stable, no issues. The lens cannot do any harm to your eye. So you never really have to think or worry about the fact that you have a lens inside your eye. It'll be prudent to just, have a regular annual exam with your doctor after this procedure, just to make sure everything is going fine. The other question that patients really tend to ask is that in the long run, as you age, if there are other age-related changes that happen inside the eye, like cataract or something, can you undergo treatment for that? And the answer to that is yes, absolutely. Your surgery for cataract surgery would be almost no different than what it is for anyone else. The only difference would be the first step of surgery is we remove this lens and then proceed with surgery as per normal. So really the lens does not interfere with any other treatment that you have to undergo in the eye ever. Does not really cause any other problems inside the eye. It is very safe.